Good evening. This is Michael with Love and Freedom. Today, I want to share a story about a doctor here in Yuma, Arizona area that was pretty much, you could say, terminated or was put in timeout for his participation in voicing his opinion about the COVID-19 um, pandemic, widespread increasing cases in the area. And the Yuma Regional Hospital held it against him because he went out and tweeted about the widespread in the area, and he would like to mandate, masks and closing schools and other things. And they actually uh, took it upon themselves to suspend him uh, without notifying that they had suspended him. But I'm going to go ahead and read what was posted in the Arizona Central news article about the doctor. The doctor name is Dr. Cleavon Gilman. He's a well-known emergency medical physician, has been asked not to return to his work at Yuma Regional Medical Center for his social media posts about the severity of the COVID-19 pandemic in Arizona. According to him and his staffing agency, what I do not understand about this is I've been advocating for Arizona. I've been calling for a mask mandate, closure of schools, and indoor dining, Gilman told the Arizona Republic. I did all of this because we are seeing an unprecedented number of cases. This is my third surge. I know how this ends. So what he basically was venting to the public that he's been through this numerous of times and he know what the outcome is going to be. And he's been advocating to try to close down schools and indoor dining, due to the surge of the pandemic. And then it goes on to say that the hospital said in a statement later Thursday night that there have been a misunderstanding and Gilman is scheduled to work this weekend. And Gilman came back and tweeted, said, "That's news to me." Gilman, who in June moved his fiancee and his two kids from New York to work in Yuma near the U.S.-Mexican border and served a small community during the pandemic, has not been to work since November the 23rd. Now, take it in granted now, he just started to work November the 22nd. He was only on the job for one day. And Gilman stated, "I started on November 22nd." When Gilman tweeted, I just got to work and I was notified that there are no more ICU beds in the state of Arizona." That's what he tweeted on his tweet on November the 22nd. Is the day in which he started his job there at the Yuma Regional Hospital. And he said, "What happened to the 175 beds? Question mark. We likely don't have nursing to staff them," he added. The Arizona Department of Health Services at the time reported that 90% of the ICU beds were in use. So what he was saying is, when he got there, before he got there, they was notified that there was 175 beds available. And as soon as he got there to start to work the first day, they stated that there was no more beds. And he asked him what happened to the 175 beds that was recently told to him that was available. His tweet had received more than 81,000 likes and 30,000 retweets. Gilman said he finished his shift that day without a problem. And he goes on and said the next morning, November the 23rd, Gilman had just arrived at the hospital when he received a call from the healthcare staffing company he works for, Envision Healthcare. Envision told him that the hospital didn't want him to come back to work. Now, taking in mind that this young brother had just started working at the hospital only one day when he got there and seen that it needed to be addressed issues, that it was a lot of issues going on in the hospital dealing with the pandemic, and he wanted to address it. But uh, I guess that Yuma didn't want him to be in there being a whistleblower. So they decided to tell him not to come back to work the next day. He said, "They told me it was because of the tweet, and I couldn't believe it because that was accurate information I posted to inform the citizen of Arizona," he said. "It is a grave injustice, and it is not just happening to me. Doctors everywhere are afraid to speak up." He's letting everybody know that there's more going on with this pandemic that's being said. And if you voice your opinion, you speak up about it, that you're going to be some type of reprimanded for speaking up and telling the truth. This guy is on the front line, boots on the ground with this. And he wanted to let the people know in the community what was going on and how to address it and try to get it under control, possibly handle it where we could save some lives. But that ain't what they wanted. Gilman was scheduled the following 3 days, but the hospital did not permit him to come in, he said. Wow, sad. And all he know is that it happened. Hospital is trying to crush my voice, he said. They want to silence me and they want to financially hurt me. That's all I, it's so wrong. It is so wrong, he said. That's all it is. It's so wrong. In a time when Gilman said hundreds of thousands of his colleagues are forced to leave the front line due to burnouts and rising infection rates among healthcare workers, it is a slap in the face to sit on the sideline for no reason. When he's saying that he's been put on the sideline for voicing his opinion, speaking up what's been going on when they short a staff and they could be utilizing his assistance. But regardless of whether or not he holds a position at the hospital, Gilman said he isn't going to be quiet on social media at any time soon. This brother said he's going to continue to march and fight uh, for the people in the community because that's what he took an oath to do. Around 11:45 p.m. Thursday, Yuma Regional Medical Center said in a statement posted and Twitter that while he is not speaking on behalf of YRMC, we respect Dr. Gilman's right to share his personal perspective on the pandemic. We need good caregivers like Dr. Gilman. Here, the statement stated. And Yuma also went ahead and put in a tweet. You can see the tweet up here or over there. You'll see the tweet up there. Um, Gilman also spoke out about the COVID-19 response into Arizona. He went on. He said, I served as a hospital corpsman in the United States Marine Corps, Hoorah, Semper Fi, Devil Dog, during the Iraq War, well before becoming the chief resident of emergency medical at the New York Presbyterian Hospital during the beginning of the pandemic. A moment in the history, he said. It was worse. He said it was worse than war by a long shot. He's saying that he's seen more bodies in that hospital dying due to the pandemic than he did during wartime when he was a corpsman in the Marine Corps. The death toll during the entire Iraq war was equivalent to what we see now every single day, he said. You can leave a war zone if you can't handle it. COVID is everywhere. You know, the story went on. He said it started March the 20th. Gilman began documenting what was happening on the front lines in his own on his online journal. Hashtag CleavonMDjournal. He started his own journal, letting people know, so he can have a journal to keep up with everything. Now, that's a smart man because, what we learned in the Marine Corps, first of all, they always stated if it ain't in writing, it didn't happen. So document, document, document. I tell everybody that all the time. Document, document, document. And his first post, he stated, tough night last night. That was his first night there at the hospital. Um, intubated a young woman with a history of smoking who was decapacitated very fast. She was decomposing. He said, there are so many COVID cases in New York City, he stated. His post about COVID-19 drew worldwide attention, thanks in part in their insight in a hot spot in the early days of a pandemic. Approximately 200,000 cases of COVID-19 was reported in New York City during the first 3 months of the pandemic. In the spring and the summer, he talked with Men's Health Insider, but his permits of skyrocketing with the tweet about ICU beds in Yuma kind of put a damper on that because he came in voicing his opinion. And since that initial tweet, dozens of his threads threads have gone viral. Gilman has used his platform to speak about our pay cuts for healthcare workers, COVID-19 death among children, and the lack of action from President Donald Trump. The post has been retweeted by celebrities such as John Legend and elected officials such as Arizona State Secretary of State Kathy Hobbs. On November 25th, he was featured in the New York Times for the article about COVID combat fatigue. I truly believe I have a moral obligation to Arizonans to be honest with them, Gilbert said. Gilman said. I can't be quiet while more than 2,000 people are dying every day. More than 2,000 people dying every day. And they want to silence this man for speaking up on what's going on. So that kind of make you wonder, why they want to keep this a hush hush. Is it fearing that people will panic, or people won't come out, and it will spike the economy to downfall, and because people won't spend money, or I don't know what their intentions are, but they are doing it. And this man is speaking up about it, you know. So, he said that what kind of doctor would I be? What kind of public servant would I be? I can't live with the silence they are asking me for. Say on December the 5th, President-elect Joe Biden called Gilman to thank him for his advocate and his service in a video of the call on Biden-Harris transitional team Twitter. Biden said, I promise you, Doc, you are going to have a full-blown partner. You have my word as a Biden. And I posted up here on panel, you'll see where he was on the phone talking with Joe Biden. I wasn't able to put that whole video up of the actual phone call, but you can actually go back and view it on Biden Harris Transitional Team Twitter. And they have the whole phone conversation with Dr. Gilman on there. That was awesome that Biden did reach out to this brother to try to give him some support, whether it's a support, moral support, or if it's going to be some action implemented. But he has brought a lot of attention to this incident with him. And I commend him. I commend this brother for actually speaking up about what's going on front lines. Like he said, there's a lot of people that's on front lines are scared to mention what's going on. Envision, he said that Envision, his healthcare services that he contract with, they has backed him for 100%. So it's no fault at them. In the statement he sent to the Arizona Republic, an Envision Healthcare spokesman said that Envision fully support Gilman and said that the loss of his position during the ongoing pandemic will be unfortunate. As a physician on the front lines, he has continuously advocated for his patient and the health and the safety of the Yuma community, a traditional medical underserving community, the statement said. We recognize Dr. Gilbert deep of the experience, perspective, and voice he lends to those who might not have one due to the inequities in the complex U.S. healthcare system. His statement concludes by saying, Envision has team based in communities across the country, and which will be fortunate to have a skilled and dedicated physician like Dr. Gilman by their side. However, Gilman said that he does not believe he should have to leave Yuma at all. And I agree with him. Why run from that? Because you want to call it a whistleblower, or, he's speaking up and giving you the nitty gritty up front of 100% of what's going on behind the scene. So I wouldn't leave either. I wouldn't let them run me away from the truth. And he said that he shouldn't have to leave that at all from Yuma. Yuma County has the highest rate of cases per 1,000 people in the state, according to the Arizona Department of Health Service data. So, he said the people of Yuma deserve an honest doctor who gives them the truth and who cares about them and who advocates for them. Gilman said, they have trusted me and I am not leaving them without a fight. Amen to you, brother. Like I said, I don't know what's really going on with Yuma, Arizona, but I go over to Yuma, Arizona for to take care and conduct my business from time to time. And I just went there this week, and I went into some establishments, public places, and there were people in there without masks, having masks on. There was no social distance. For example, you go into Walmart in Yuma, Arizona, they have no one at the door trying to disinfect anything, or they don't have no. They have a tablet like they counting people, which I don't think they're counting people. How many people can be in there at one time? Not like here in Mexico. When you go to a public place or go to an establishment, a grocery store, or anything, they're meeting you at the door, greeting you, scanning your temperature, disinfecting your hands, disinfecting your shoes. You do step on a mat with disinfect you, and they check your temperature, make sure that you don't have any fever or anything, that you may not have any sort of symptoms. And then once you clear, you are allowed to proceed on into the establishment. And that's a good thing. I have not seen that yet happen in Yuma, Arizona, since I go over to conduct my business. And I don't know what it is about Yuma, but I think Yuma is actually afraid to let people to actually know what's going on, because they do have a lot of winter visitors in Yuma, elderly people that comes over, retirees that spend money in the community, and they're afraid to have them to panic, and that may cause them to have a drop in the economy or whatever. But me personally, I don't think that winter visitors spend much money, because they're on a fixed income, and most of the time they just there just to get away from the cold weather. That's all they fleeing from. So they on a fixed income, they're not spending money. So I don't know why they're protecting the winter visitors so much. But you can go ahead and go. I'm going to drop the information to Dr. Gilman's Twitter page. And other information that I might have gathered. You can go down in the comment section and see that information. Get out there and help support this young brother, because this young brother is actually voicing his opinion on the front line, and it's not right what they're doing to him. But I'll keep you posted on the information as it comes to me. Until the next one, bye now. Peace. One love.